Hi again, Dr. Gillard here. It is week 8. It's Thursday. It's spring 2020. Let's do some CVPP, cardiovascular and pulmonary pathology. Really just cardiovascular we're talking about today. Remember last time we talked about this and I warned you how important it is. This is the MEA Wheel, I call it for short. But this is how you map or how you quantify the electrical flow through the ventricles or through the atria. There's got to be a way to tell how the flow of electricity is going through your heart. And to quantify that, they've created a kind of a weird wheel here. And it's got some degree signs on it. So we went through this last time, but all of the limb leads are plotted along this wheel at different places. For example, limb lead 1 is right here at 0 degrees. Everybody stick your left arm straight out, 90-degree angle between your arm and the floor. In other words, your arm is parallel to the floor. That is the vision of limb lead 1. If limb lead 1 is a camera, it's looking at the heart in that direction. Therefore, it'll usually see the flow of electricity kind of obliquely. Limb lead 2 down here at 60 degrees. AVF, the peeper, right down, looking straight up. That's AVF. Limb lead 3, 120 degrees. All right. AVL, negative 30 degrees. So if the current is flowing at AVL, is that a normal mean electrical axis? No way. Mean electrical axis, what's normal? The normal flow through the ventricles should be between 0 and 90 degrees. The atria is pretty close to that. The atria normal flow is a little bit more to the east-southeast, but typically the flow through the heart is normally between 0. There's some odd instances where normal might be negative 5, negative 10, or even 110, but for our purposes, 0 to 90 is a normal mean electrical axis. Everybody got that. Everybody understand this. Then we have AVR over here as well. That's the only right view of the heart from the right side. Okay, so we learned about that last time, but now let's make some use of it and actually find out or figure out where is a person's mean electrical axis. Which direction is it traveling? Are you normal? Are you off center? And yeah, another important thing, when you hear the word mean electrical axis or what's the axis, maybe a question might say, what's the axis of the heart? They mean the mean electrical axis of the heart. That's what they're trying to say. And always assume it's ventricular mean electrical axis unless they specifically tell you they want the atrial mean electrical axis. If they say electrical axis or mean electrical axis or just axis, assume it's ventricular. Okay, if they want the atria, which they're probably not, that's not going to kill you if that axis is off. The left ventricle or the ventricular mean electrical axis is the one that'll shorten your life. So that's assumed. Which way does it normally travel? We kind of said this already, but if you're a compass person, it travels pretty much right to the southeast. Actually, who's the limb lead at the southeast? Well, that's limb lead 2, right? There's the limb lead. It's a camera right there. It's watching from the southeast, so usually the current flows right at limb lead 2. As I said before, it's normally between 0 and 90 degrees. And yeah, similar to the atria mean electrical axis, which is more east-southeast, typically right at limb lead 2 or limb lead V5. We're not going to get into the precordial leads too much. We just don't have time. I need the whole quarter to really dig into this. So who cares about this stupid mean electrical axis? Why do I need to know this? Well, if you're going to use EKG in your practice, it's a great indicator without bombing the patient with radiation. It's a great indicator of finding left ventricular hypertrophy or right ventricular hypertrophy, which are both life-shortening diseases. Myocardial infarction is going to cause one of those, so in and of itself, it'll swing the mean electrical axis. Well, it would. That would swing it to the left as well. So I guess we'll leave that in there. I didn't really talk about that much, though. Okay, but we can use that to detect pathology. Brainteaser. If the mean electrical axis of the right ventricle, with expensive and fancy equipment, you can split the right and left mean electrical axis. So if the right mean electrical axis really travels to the west, I mean, that's that way, right? There's the west, right? Everybody knows their compass point. So I don't know. Do you guys know your compass directions? With all these iPhones nowadays, you guys never learn to use a map, probably, many of you. But yeah, so the flow of electricity through the right ventricle is usually to the west. Then why is the overall mean electrical axis, ventricular axis, to the southeast? That's the left ventricle. Left ventricle is massive, and it electrically dominates the heart, and it pulls it back. It pulls it back to the south. It's more east-southeast, but it kind of averages out to southeast or southwest. I'm sorry, it's east-south. I don't even know mine anymore. It's east-southeast direction. So it's a little more to the east. So the west pole of the right ventricle pulls it back to the southeast. Understanding the waveform. So the shape of the waveform captured on the EKG paper, we said this already, all depends on the lead's view of the heart. Remember the elephant. And that view of the heart is called the angle of orientation. This is the angle of orientation of this camera. That happens to be where limb lead 2 would be, but that's its view of the heart. So it's going to see, that's the only view it can see. It can't turn. So we have AVL over here looking, right? So that's its view of the heart. So they all have a different, and therefore the wave shapes produced on EKG will all be a little bit different. Does that make sense? So this is important. Positive waveform. That means that a wave depolarization moving head-on to a current will cause the camera to see and write a positive waveform. If this is the isoelectric line here, what's a positive waveform? It's a wave that goes like this. What's a negative waveform? It's a wave that goes below the isoelectric line. In fact, what is this wave called I just drew? That's called a biphasic wave. That's going to be the kind of the key of this lesson today. Which, by the way, this is a tough lecture right here. People have trouble understanding this stuff, so I should have kind of warned you guys up front. This is important stuff to know, and it's not that easy. If you don't come to class and watch this, you're not going to do well in this part of the test. All right. So in other words, it produces a positive. This is a positive or upright waveform right there. This is a negative waveform or downward facing waveform. Okay, pretty simple so far. As long as there's more wave above the isoelectric line, it's still considered a positive waveform. So it doesn't have to be perfectly biphasic. Even if it's a little bit here and then the downward portion is much bigger, that's still considered the positive waveform, still considered the negative waveform. Negative waveform is the opposite, a wave of depolarization moving away from a camera or a lens or an electrode that produces a negative deflection below the isoelectric line. So those are called negative waveforms or downward waveforms. Okay, and same thing, as long as there's more of the wave below the isoelectric line than above, it's still considered negative. What about a wave that's moving perfectly perpendicular? This is a very, very important concept. What about a wave moving perfectly perpendicular to an electrode? Well, that electrode, if it's perfectly perpendicular, it will draw a perfect biphasic wave. Biphasic, again, means there's equal amount of positive waveform and equal amount of negative waveform. It's perfectly symmetrical. Here, I'll try to draw it with the best of my abilities. That's pretty much a biphasic wave. That means the up part of the wave is just as great as the down portion. Positive is great as the negative. And if we see that, we know then that the camera is looking right this direction. A little better camera. There's the camera's view. If you can understand that, you're going to be just fine on figuring out these mean electrical axes. Okay. Here's an example of a biphasic wave I just drew. Only in EKG, of course, it's more like that. This is a monophasic. We do see these. Do you guys know a monophasic wave? Sure you do. P wave, T wave. They're both monophasic. Do you know a biphasic wave? QRS complex produces a biphasic wave. And that's what we're interested in this whole subject. We're going to be looking only, well, later on we'll look at the P wave, but we're looking at the QRS complex. All right, so here's a picture. Here's a wave moving through this person's heart. Right? So if you had a limb right up here at, this would be negative 90 degrees. That doesn't matter though. But here's the camera view. And so as this wave goes by, this is what this limb lead, or this lead B we'll call it, it draws a perfectly biphasic wave. Okay, with the upper portion, the positive part of the wave is just as great as the negative portion. What about a lead that lead C is, they should have actually put it more like this, coming head on. There's the camera. It's coming head on. It's going to draw a wave that is monophasic, right? Monophasic, biphasic. Right, so it's all above. Now what about a camera that's looking over here and the wave is going exactly away from it? Well, it's going to draw a monophasic wave, but it's going to be a negative waveform. Super important that you understand this slide, right? Because is the current really going to go perfectly biphasic or perfectly perpendicular? Usually not perfect, but you're going to find, if you look at all those limb leads, you're going to find one that looks pretty darn biphasic, but not perfectly. So what about these non-perfect biphasic or almost biphasic waves? Lots of stars here. So sometimes the waveform created by the mean electrical axis, it's close to biphasic but not perfect. In fact, these are the ones we're going to be looking for to determine the mean electrical axis. All right, this means that the mean electrical axis is running almost perpendicular but not perfectly perpendicular. And once we figure out which lead to use, we can tell whether the current is running a little bit more away or a little bit more towards the camera or the limb lead. Okay, I'll explain that more. So we can figure out the MEA by looking for something that's almost biphasic. If you can find one perfectly biphasic, great. Then it's really easy to figure out where the current is flowing. But in reality, as you're going to see here in a minute, you're never going to find one that's perfectly biphasic. Well, I shouldn't say never. You will occasionally, but probably not on my test. So, almost biphasic rules. If the positive half of a waveform has a greater magnitude than the negative half, and this applies for all limb needs, the exception is AVR. AVR is a little backwards, but let's just not worry. Let's pretend AVR doesn't even exist right now. All the other limb leads, this works. If the positive half of the waveform, and for purposes of our class, the positive waveform, that'll always be to the left. Like you read left to right, we're going to always assume the current's flowing left to right for right now. But whether it be a little one or whether it be a great big one, it's always going to be to the left. The only one that messes this rule up, but that still works with AVR, but AVR is reversed. It'll be down, and then the trailing wave will be up. But don't worry about that. You probably shouldn't even say that. It'll mess you up. All right? So if the positive waveform, and we're talking about a biphasic wave, so if the positive portion of it has a greater magnitude, then the MEA is heading right more toward that lead than away. Remember, if it's perfectly biphasic, it's heading at a perpendicular to that lead. But if it's not perfectly biphasic and the positive part of the limb lead is bigger than the negative part, then it is heading more at the lead than not. The negative is just the opposite. If the negative half of the wave has a greater magnitude than the positive, the first positive part, I said left part because that'll be more on the waveform to the left. Then the mean electrical axis is heading more away from the lead. All right, that makes probably not much sense to you, but now let's kind of let's further explain this. With pictures always work best. So here we have a camera, right? Here's the lens. And the camera, of course, is a limb lead, the positive limb lead. Let's call this the peeper. Let's call this AVF. Why not? Because it's looking the same way the peeper would look, straight up. So if a wave of depolarization is running like this, is that perpendicular? Is that perfectly perpendicular to our camera here? No. Where would perfectly perpendicular be? I'm going to try to draw a perfectly perpendicular line. Would we, well, I screwed it up there at the end. But would we agree that's much more perpendicular? I mean, if I can do, I have to put a line like this to help you see. What's the definition of perpendicular? It means there's a 90-degree angle right here. So this blue line is not perfect. It's close to perpendicular, but it's not close. So the camera, when it sees something like this, with the wave heading perpendicular-ish, but it's actually heading a little bit more towards the camera, then this would be away from the camera. If it's heading toward the camera, it's going to draw the positive part of the waveform bigger than the negative part of the waveform. Okay? Stop that, play that back, get that in your brain. Then vice versa, what if on EKG you don't see this setup, but you see this picture on a waveform? What if you look at AVF, and this is the waveform you have? Well, you got a pretty darn good idea of the flow of current through the heart at this point because this is almost perpendicular. So you know that the current is flowing almost perpendicular to the AVF, but it's not perfectly perpendicular. So you look at the bigness here, it's a greater magnitude. That tells you that in reality, it switched to pink. In reality, because it's bigger here, that means the current is really heading like this. All right, if you can understand that, you've won the game and you'll be able to answer 2, 3, maybe 4 questions on the test. If you don't get this right, you probably won't get an A on the test. So you got to understand this stuff. Right? Let's look at the other side of the coin. Here's a current. Here's our same little camera here. It's the peeper again. It's AVF we can use because that's the way it looks. And this is the way it looks. It looks this direction. It can't move. It always looks this direction. And now we just passed a current by it. So this current is it's almost perpendicular. Not close, but for all practical purposes, I mean, it's kind of heading at limb lead 1 over here. All right? I'll show you. For now, we'll just assume it's going this way, but we have to show you how to do that. So therefore, this AVF would draw a mean electrical axis. In this situation, it's slightly going away from perpendicular, isn't it? Right? We got it? Let me try to draw this again. All right? So that would be ideal if the current was running like that. If it was, we'd draw a perfectly biphasic wave, but it's not. This current is running slightly away from AVF. So therefore, away means that the negative portion of the waveform, the second portion of the waveform, will be bigger than the first. So this AVF draws this scenario right here. We have a littler, smaller positive waveform and a much bigger negative waveform, right? And of course, this is where the questions are going to come backwards. You're going to get to see an EKG tracing, and you'll see, okay, AVF, okay, it's kind of perpendicular. We have a biphasic wave. So we're going to use this one, but is it perfectly perpendicular? No. Is the waveform coming more toward the camera or away from the camera? Because this is small, that means it's going away from the camera, just like this line is right here. So this is the true mean electrical axis. Got it? All right, think about it. We'll do a bunch of examples here in a second. What about the wave of repolarization? We're not going to worry too much about that, but depolarization and repolarization actually run in different directions. So yes, there is a wave of repolarization. In fact, we know a good example of that, right? The T wave is a wave of repolarization. Right? So the MEA is heading away from those leads, but because it's repolarizing, the wave is still positive, because that's the way it works. All right, figuring out the MEA. Here we go. So can you predict, and here's maybe a sample question. Can you predict which way the mean electrical axis is traveling based on this waveform? Right? So we got a biphasic wave. We have limb lead A. We don't have really a lead in this direction before, but for this experiment, that's what we got. So which way is the mean electrical axis heading? And for now, we're going to assume it's heading left to right. Well, is it heading up here, or is it heading straight, or is it heading down? How do you do that? Well, you look. Is it perfectly biphasic? No. So it can't be this one. Right? If it was perfectly biphasic, then it would be. If this, I mean, the view of the camera is straight down. If there's a 90-degree angle here, that's perfectly biphasic. But that ain't happening because it's bigger here and smaller here. So what's the rules you just learned? If the positive portion is bigger than the negative portion, then that means it's heading more toward the lead. So this is correct. This one is wrong. Why is that wrong? The flow of electricity through the heart can't be going like that. If it were going away from it, this would be tiny and this would be huge down here. Got it? And that's the correct answer. Finding the real axis of the heart. Now we're going to get a little deeper. So the question could say, find the axis of the heart. What does that mean? That means find the ventricular mean electrical axis of the heart. The question might not go that far, so you need to understand what the axis is. Okay. Remember, normally the mean ventricular, or the MEA, mean electrical axis of the ventricles, the flow of current through the ventricles, is normally between 0 and 90 degrees. You have to memorize that number. That's very important because certain conditions... What happened to my little thing? That's weird. Certain conditions will push the mean electrical axis clockwise or counterclockwise. Okay? Is the axis of orientation normal? Well, you might get a question like this. Here's an EKG tracing. Is this a normal? Does the patient have a normal mean electrical axis? If you're not like an angle person, I'm an angle person. It's really easy for me to see things like this, like geometry and things like that. It's really easy. But if you're not a kind of a picture person, you can straight up memorize to get the answer of whether it's normal or not. There's 4 rules that you have to know. If the mean electrical axis is normal, these will always be true. So limb lead 1 will be positive, mostly positive. Limb lead 2, and I'm talking about the QRS complex here, right? This whole section is talking about Q. When you're looking for the axis, you're talking about the QRS complex only. We're not worried about the P wave, not worried about the T wave, only the QRS complex. So QRS complex will be positive in lead 1. It'll be positive in the peeper, AVF, as well. It will be negative in AVR. And AVL has to be a little bit biphasic. If these 4 questions are true, then you have a normal mean electrical axis. I think for me, it's easier just to find the darn thing. And is it between 0 and 90? Yeah, it's normal. All right, so is the mean electrical axis normal in this patient? So don't pay attention to this right now. We'll just look over here. And we can cross these out, right? Because the axis has nothing to do with precordial leads or chest leads. So don't worry about those. So what are the rules? I put the rules here to help. So limb lead 1 is mostly positive. Is that true? Is limb lead 1 mostly positive? Absolutely. And we're talking about the QRS complex only. Is that biphasic? Well, and remember, most of these waves, you don't see a Q wave. And that's why we're really just working with the R and the S wave is what we're talking about as being biphasic. But yeah, that's definitely positive. How about the peeper, AVF? Is that mostly positive? Absolutely. So number 2 is true. What about AVR? Is that mostly negative? Absolutely. Mostly negative. Just a tiny little blip above the surface of the isoelectric line. And is AVL at least a little biphasic? Where's AVL? Yeah, not much, but it is a little biphasic, right? Has a much bigger kind of down limb, or the up limb is here, the positive portion. But yeah, it is a little bit biphasic. So is this a normal mean electrical axis? And the answer is absolutely. Okay, yeah, everything I just said. Awesome, let's do another one. So right and left ventricular axis deviation. So left, this is important too. Left axis deviation means that the mean electrical axis has gone negative. It's went more counterclockwise than normal, and I've showed you that already, right? So here's normal between here and here. Here's that wheel, the mean electrical axis wheel, we'll call it. The mean electrical axis has to be going this way, so it has to be counterclockwise. It could be up here, could be here. Technically, it could be here. If it's past 0 degrees, if it's gotten in negative, it is a left axis deviation. What is left axis deviation? Why do we care about that? That usually indicates very high, up in the high 90s, the sensitivity of this test. Left ventricular hypertrophy, it indicates. Why would somebody have left ventricular hypertrophy? Probably secondary to long-time chronic uncontrolled hypertension, or they just haven't taken their meds very much. What about a right axis deviation? That means that the mean electrical axis has gone too far positive. In fact, it's went too far this way, right? So it's too positive. Remember, this was 90 degrees. Normal was 90 and 0. So it's traveling this way. So it's went too far. It's went past 90 degrees, greater than 90 degrees. What does that indicate? And that's the right. That's said that the axis is deviated to the right, right? That's what they're going to say. It's deviated to the right. And how they get right out of that? It's because when it deviates to the right, that means they have right ventricular hypertrophy. When it deviates to the left, they usually have left ventricular hypertrophy. I think that's where that came from, right? So that you just have to memorize that. But if it's went greater than 90 degrees, it's right deviated axis. Okay, is the MEA deviated right or left? Well, what's the process? And we'll go through this. What's the process of finding if it's the MEA is deviated right or left? First thing you do, and we're looking again at the QRS complexes, and we're only looking at limb leads. So the first thing you do is you find the limb lead that is closest to being perfectly biphasic. If you find one that's biphasic, the game is almost over. But most of them will be biphasic, but not perfectly biphasic. Okay. Then step 2 is so that's step 1. Step 2 is you're going to determine the flow of the current. And so let's say this is where we think the mean electrical axis. Let's say it's a AVF again. Okay, and we drew a perpendicular. So to determine the direction of flow, you just have to look at a camera that's in the line of flow, the proposed flow. Okay, and there's not really one. AVR is up here. Limb lead 1 would be here, so we would use limb lead 1. If its QRS complex is really crazy positive, then we know the current is flowing toward it. If it's negative, that means the current is flowing away, because we've learned that a limb lead, or any lead, if it sees a current heading straight at it, it's going to make a positive wave. If the limb lead is traveling away from it, it's going to make a negative lead. Okay, so once you have the direction of flow, then you're going to determine the real mean electrical axis by noting whether or not the positive portion of the biphasic wave is greater than the negative, or vice versa. Okay, let's go through an example. So, 52-year-old patient comes in with dyspnea on exertion. He's got mid-back pain and chest pain. You run an EKG. So question 1, is the MEA, the mean electrical axis, the flow of current through his ventricle, left ventricles, or through both ventricles are combined, is it normal? And the second question, what exactly I want to know exactly what the mean electrical axis is. And again, 0 to 90 is normal. So how would we work this one? Well, you can use those rules for the first question. So limb lead 1, is it positive? Yes. Is the peeper positive? Yes. Right? QRS complexes are way positive. Is AVR negative? Yes. And then the last box that you have to tick, AVL, is it biphasic? A little bit biphasic at least. Yeah. In fact, it's more biphasic than any other lead that we have here. This has got a little blip here above, but limb lead 1, that's almost completely uniphasic wave. All right, but AVL is biphasic. So yeah, So is the mean electrical axis normal? You bet. What is the mean electrical axis? All right, so there's everything I just went through. But now, how do you find the exact mean electrical axis? So step 1, find the most biphasic limb lead. We already said, here's the limb leads. Which one is more biphasic? It's not super biphasic, but that'll work. So AVL, done with step 1. Step 2, use the MEA wheel to, using the MEA wheel, draw what a perfectly biphasic waveform would look like. So if the current was going perfectly, what would the MEA look like? In other words, take the line of vision. Here's AVL right over here. Right? There's the camera. There's its view. Right? I drew it off a little bit. This is its view right here. So take the view, draw a line for its view, and then draw a line perpendicular to that. In other words, 90 degrees to that. And you'll notice a couple little cheat thing here. So the AVL happens to be perpendicular to limb lead 2, right? This is 90 degrees right here. So this is really easy to draw. All right, so I did that. So I drew a perfectly biphasic wave. What do you think step 3 is going to be? Step 3, we need to know which way the wave is flowing. Is the wave flowing this direction? Or is the wave flowing this direction? Right? Which way is the MEA traveling? Which lead are we going to look at? Could look at AVR, but it's not really heading very close to AVR. Who's it heading right at? Limb lead 2. So if limb lead 2 looks like this, which way is the current flowing? It's flowing this way. If it looks like this, which way is the current flowing? It's flowing away from it. So let's look and see. You tell me. Which way is the current flowing? This way? No, it's flowing down here. Why? Because we looked at limb lead 2 and it's way positive. We can confirm AVR should be pretty negative looking because it is flowing away from AVR and it is negative looking. So that kind of double confirms. So now we've drawn a perpendicular. We have an idea of where the current is flowing. It's not perfect because it's not a perfectly biphasic wave. If it was perfectly biphasic, this would be done. The mean electrical axis would be 60 degrees, but it's not. It's not perfectly biphasic, so we got some more work to do. But we know the direction of flow. We already know it's going to be normal. This is a normal flow. There's no way it can go down any further than this. But let's keep going. So now find the fine-tuning the perpendicular. So we know that the current was not perfectly perpendicular, but we do know the mean electrical axis, or is the mean electrical axis heading more away or more towards AVL? So that goes back to that basic thing I said. Here's the view that AVL has drawn for you. So is the current moving toward or away? Well, if it draws a small positive portion, that tells you the current is heading more away from it. And so in this scenario, what would be heading more away from the current? Well, we're using this one right here. So is it going like this? No, it's got to be heading more away from it, like this. And that's exactly where the current is going, right? And you can double check that. If it's heading between limb lead 2 and AVF, these two should look pretty much the same with regard to the QRS complex. And is that true? So limb lead 2, it's almost completely biphasic, or completely uniphasic. It's just got that little piece right there. How's the peeper look? Looks almost exactly like that as well. Okay. And this, by the way, I think this is a drawing of a real tracing, so just to make it easier for you to see. All right, so everything I said there, and then you just have to figure out what the degrees are. Well, if it's between 60 and 90 degrees, probably going to be what, like 75 degrees, right? You can, 140, you can add these two, 60 plus 90 divided by 2, 75, right? 150, 75 and 75 is 150. Is that right? 40? Yeah, 150. So that's the answer. Let's try another one. 62-year-old guy comes into your office, got some malaise and blurred vision. I'm probably not going to give you all these hints on these tests either, because I can figure this one out without even, well, some of it I can. He admits he's not the best at taking his blood pressure medication. He's been on blood pressure medication for 20 years. You take his blood pressure. He says he's on medication, but it's 160 over 105. I hope he's lying, because that's uncontrolled hypertension. You run an EKG. The question is, what is the mean electrical axis? All right, look at that. Take a drink of water while you figure out what's going. Is it normal? I should ask you that. Is it normal? It's not normal. Right? The peeper's not mostly positive for sure. Number 1 is, I guess it's mostly positive, but it's looking a little biphasic. R is not mostly negative, so no, this is not a normal mean electrical axis. But let's find the mean electrical axis. So what's the first step? Who is the most biphasic wave? Here's a rule to make it easier. If AVR is biphasic, limb lead 2 is usually biphasic. So it's best to use limb lead 2 with these, because the polarities sometimes are reversed and it kind of breaks the rule a little bit. It still works, the rule still works, but it's a little harder. We'll do an AVR in a little while. All right, so I think it's nice and easy to take limb lead 2. So that's our most biphasic. So we're going to look through the eyes of limb lead 2 to determine this. Okay, limb lead 2 is biphasic. Okay, just based on this, well, we need to know, the next step is we need to know which direction things are traveling. And I worked really hard to make some new, I guess I didn't go back further, so got some better ones coming. This is a little bit older. But let's figure it out. So here, let's draw here's the eyes of limb lead 2. Let's draw the perpendicular. Okay, so ideally that would be great. The next question is, which way is the current traveling? Is it traveling this way or that way? So how are we going to answer that question? Well, you pick. We got AVL over here, and we got limb lead 3 kind of over this way. So you pick. If it's heading toward, let's use limb lead 3. If it's heading right at limb lead 3 QRS complex will be mostly positive. Is it mostly positive? No, it's negative. So just to double check, look at AVL. Mostly positive or negative? Positive. So which way is the current headed? It's headed closer to AVL. So the current is headed this direction. So now that we know the direction of current flow, we can answer the question already. Is this a normal axis? No. 0 degrees would be right here. So it's off. Right? Roughly which way is the current flowing? We just did that. We used AVL. So, yep, it's flowing that way. So I drew the arrow in here. All right, so that would be, or actually, if you look at this, now this would be perfectly perpendicular. Now let's fine tune it. Oh, I should have went back and fixed this to make it easier. Let's fine tune it. Is there more? Is the positive part of this biphasic wave greater, or is the negative portion greater? negative portion. So that tells us, by definition, the current is flowing more towards the camera, like this one, more towards, or more away, like this one. I guess I gave you the answer. It's flowing more away, by definition. Oh, I see. I guess I should have followed that. Sorry about that. All right, so then what's the axis then? Well, if it's flowing more away from AVL, it's going to be over in this direction here. So 45 degrees or so, something like that. Yeah, so there it is. There, it's about 45 degrees. Is that normal? No. What's the diagnosis? Left axis deviation from left ventricular hypertrophy. Right? Left ventricular hypertrophy typically causes a left axis shift. We already said that. Or a counterclockwise shift, and people aren't going to say that. They're going to say a left deviated axis. Atrial flutter, by the way, can also cause this. Classically, left ventricular hypertrophy is caused by chronic hypertension. For whatever reason, your heart has to pump harder to make pressure normal, and it wears out the heart. The heart gets really muscular for pumping hard. But it can't do that forever. Oh, we're going slow today, aren't we? Let's do another one. 55-year-old comes in your office complaining of a chronic cough and dyspnea on exertion. Condition has been worsening. The jugular veins sticking out. Kussmaul sign is positive. 35 years of smoking's going on. Do an EKG. The important part of this is do an EKG. What do you think with regard to the mean electrical axis? Is the axis normal? And I want to know exactly what the axis is. What's step one? Well, is the axis normal? We can go through is limb lead 1 mostly positive? No. So we immediately know the axis is not normal. What is the axis? Find the, I'm going to make a note here. Okay, who's biphasic? Find who's biphasic. AVR is kind of biphasic, but I said stay away from AVR if you can at all help it. Oh, limb lead 2 is beautiful, right? Limb lead 2 looks great. I can already tell you the answer to this, but we haven't. By looking at the P wave is funky. But we're not focusing on the P wave, just the QRS complex. Is it perfectly biphasic? Geez, it's pretty darn close, isn't it? I'd say maybe this is up a little bit higher here, but it's pretty darn close. Or is it maybe, let's see this one. It's pretty darn close. I didn't measure the box. I'm just kind of eyeballing. Maybe that's actually this looks a little bit bigger here. But for all practical purposes, all we need to do is draw the perpendicular. So step 1, who's the most biphasic? Okay, this is where I thought I should have went back one further. Who's the most biphasic? Limb lead 2's right there. And that does look a little bit stubbier there to me. I could count the little boxes, but I'm too lazy. Yeah, so it is a little bigger there. Okay, but for this step 1, we just need to know who's biphasic and limb lead 2. So this is the one we're going to be working with. Step 2, draw a perfectly perpendicular to limb lead 2. That's got to be fixed. 362. What I'm trying to say is, using the angle of orientation of limb lead 2, draw me a perfectly perpendicular running mean electrical axis. So in a real world, I mean, this is really going to be the answer because it's almost perpendicular or perfectly biphasic anyway. So in a real world, or for perfectly perpendicular to axis 2, it's going to be heading right at limb lead AVL because we said these guys are 90 degrees apart. Now the question is what? Is it flowing this way or is the current flowing that way? Who can we look at to answer that question? Well, it's flowing right at AVL. That's going to tell us the story. if AVL looks like this, is it current heading toward it or away from it? Then it means it is in fact heading toward it. So let's see. So roughly, which way is the current flowing? So AVL will give you the answer. The waveform is mostly negative. Oh, right? Yeah. So which way is the current flowing? So AVL really looks like this. So the current must be flowing this way, right? And that's way past, that's past 120 degrees. So we already know the answer. What's the axis deviation? It's right. This is a right axis deviation, way past 120 degrees. Okay. Fine-tune the perpendicular. We said that it's slightly smaller. The positive waveform is slightly smaller, so therefore it's off a little. And that might be even a bit pushing. I mean, in reality, it might be more like that. But it's definitely to the right of 120. So you're looking, 130 or something like that. Actually, if you measure it like this, it comes out 170, because this would be 180. Not sure if that's probably 160 would have been a better answer. But when I have answers on the test, they'll be like 160, 90, 60. They'll be way apart. So they're not going to be that close. But yeah, so what's the diagnosis? Well, they have right ventricular hypertrophy. What can cause right ventricular hypertrophy? Pulmonary hypertension. What are the two big causes of pulmonary hypertension? Left heart failure is actually the best one, but his left axis looked pretty good. He didn't have left ventricular hypertrophy, but doesn't mean his left heart's not failing from some other disease process. But COPD, remember, it scars up the microcirculation. The right heart tries to push blood through it, but it gets really beefy. So yeah, right ventricular hypertrophy, not as common. Let me see where we're at. Not as common as left ventricular hypertrophy. Common in patients with left heart failure, though. Everything I just said a second ago. Also common in patients who don't get their ASDs. We talked about Eisenmenger syndrome. Can also overload. All that extra blood can scar up the microcirculation of the lungs. So that's another possible cause of it. The EKG demonstrates right axis deviation. Yeah, anything to the right of 90 degrees. Let's do another one. 62-year-old male with dyspnea on exertion. You run an EKG. What do you think? We're going to start going a little faster because I didn't expect it to take so much time. Well, is it normal, first of all? What are the normal rules? Limb lead 1, yeah, mostly positive. Peeper, AVF, where is it? Mostly positive. Is it mostly positive? It's ridiculous. No. So it's not a normal axis. Now the next question is, which way is the axis going? So find somebody who's biphasic. Oh no. I said stay away from this one if possible, but we got to use it. So yeah, I agree with you. We're going to have to use AVR. You see the weird thing about AVR, and depending on how they have the polarity set on the machines, sometimes in this left to right scenario, that should be above the line and that should be below. But because it's at the opposite end of the heart, these are often reversed. So just pretend that that's still above the line and that's below the line. That's the way to handle that. All right. So, I mean, let's draw it out here. Let's scrap paper. Let's draw it out. So the first step was to draw a perpendicular to the biphasic lead that you've chosen. You've chosen AVR, which is over here. All right, so perpendicular would be something like that. All right, and then is it perfectly perpendicular? I mean, we don't have to find the direction. The next step would be to find, well, let's keep it in line. I don't mess you up. By the way, this is 0 here. This is 90. All right. So which way is the current running? Is it running this way? Or I'm sorry, the perpendicular is what we use. Is it running this way or this way? Who's down here? That's limb lead 3. If it's heading toward limb lead 3, it should be positive. Is that true? Yes. Is limb lead 3 positive? No way. It's wickedly negative. So the current is not going that way. It must be going this way. Close to who? Who's over here? AVL's over here. So AVL should be positive, right? Because the current is semi-heading at it. Is that true? Where's AVL? Yeah. In fact, it looks like it's heading right at it. So, yeah. So which way is the axis deviated to? Should never be more than that. So it's definitely deviated way, way, way to the left. And in this case, the way I just drew it, it would be further away. But it's going to be somewhere around negative 130 to negative 160 or something like that. I just kind of didn't draw that very good. But let's draw it more officially to see what it looks like. And there was step 1. We drew the perpendiculars here. Step 2 was to figure out which way it was going. By looking at AVL, we said AVL was positive, so the current must be flowing in this direction. And then we can't use a perfect perpendicular because you can see this is reversed. So the first part is small, the second part is big. So that means it's heading away from the perpendicular, heading away from the camera. So it'd be going something like that. Pretty close to AVL, as I said. So yeah, it's around 100, minus 30, minus 40, something like that. Okay. Assessment axis is way left. So left ventricular hypertrophy. The patient later admitted that, yeah, they were prescribed medication and they never took it. Another one. I think I'm doing too many of these. But we'll go fast now. 63-year-old. Okay, great. What's the axis? Is it normal, first of all? Limb lead 1 will be upright. True. Limb lead, the peeper, will be upright. Where's the peeper? AVF. Oh, that's not true, is it? No, that's mostly negative. So, no, the axis is off. Now, which way is it off? Okay, find who's biphasic. Who are we going to use? There's AVR again. I hate using AVR, but we could use AVR again. Limb lead 2 is biphasic as well. I guess I would probably use this one again. It's more biphasic looking, even though I don't like to. So AVR again, I did use it. Let's draw our perfect scenario. There's a perfect perpendicular. And then we need to find out, is it going this way or is it going this way? How do we do that? Well, look at limb lead 3, heading right at limb lead 3. If it's positive, the current is going this way. And then we have right axis deviation. Is it positive? No, it's wicked negative. So the current flow must be going this way again. So we have another case of left ventricular hypertrophy with the axis shifted way left, 30, at least 30, but more than 30, right? This is more correct. So I'm thinking this is 90. 45 would be probably about there. So it's probably past 45 degrees, I would say. Yeah, 60 degrees. Mean electrical axis is about 60. Negative 60 degrees, left ventricular hypertrophy. Left axis deviation. Got it? Let's see what time it is. All right, let's do just a little bit more. What about the P wave and the T wave? You can find the mean electrical axis for both of these. We're not going to worry too much about that, though, but you could do it if you wanted. Let's talk about this P wave. Very important. It represents depolarization of the right and left atria. Normally it's much smaller than the QRS complex because there's not as much tissue compared to the left ventricle. You don't have to push much electricity through it. And the Wiggers diagram. Oh, I always ask a question. It's a physiology question, but I can throw my scope in there because Wiggers, and some of you are going, what the Wiggers diagram? Wiggers diagram, that's the Wiggers diagram. The famous Wiggers diagram. And now you're like, oh, yeah, Dr. Doe worked with me on this. I love the Wiggers diagram. So make sure a guaranteed question, maybe more than one question on the Wiggers diagram. So let's go through it. So this is the volume of blood. It's nice to follow the volume of blood. We don't have to go through this, right? There's the P wave. Okay, that's the wave of depolarization sweeping over the atria. Then there's a stall where the signal gets in the AV node. That's the decremental deconductor. That's where it's slowed down here. There's no electrical activity in the heart while the signal is in the AV node. And then this AV node races down the bundle branches and the ventricles start contracting. You get a QRS complex. And then this is repolarization of the ventricles. Where's repolarization of the atria? It's inside here. It's hidden. You can't see it. Right? We can also watch blood. So here's the blood volume in the ventricle. Actually, in the left ventricle, 142 milliliters. You don't need to know that, but so let's start the cycle. So the atria or the ventricles contract, and you get bang. The AV valves slam shut because you don't want blood to backwash into the atria. You want it to go out the ascending aorta. And so that first S1 bang, that's the mitral valve slamming shut. And then look at how quickly the blood volume decreases as the blood is being shot up the ascending aorta. The ventricles are now repolarizing while this is happening. But once we get to the end of systole, we get a short nap. Now we have diastole, the heart is limp for a second, and therefore the stretch that was imparted by the ejection of blood into the ascending aorta, the stretch, the artery, the ascending aorta contracts and it squeezes blood back toward the heart and it slams those semilunar valves. In this case, the aortic valve slams shut and we get our S2 heart sound. Great. And then we have to fill the ventricles. And so the mitral valve pops open again and blood starts filling up the ventricles. It fills and it fills and it fills. And we might get a weird S3 heart sound during diastole, right? That's atrial and ventricular diastole. So that's where our S3 heart sound. Remember that's Kentucky, 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 long, short, short, long, short, short. Ventricular gallop, if it's pathological. May or may not be pathological. But anyway, we got the heart just about filled up with blood. The pressures are about equal. So how are we going to top off that heart? This is where atrial systole occurs. Atrial systole occurs and the atria squeeze. Ventricles are still in ventricular diastole. So atrial systole occurs within ventricular diastole, but it fills the rest, it jams the rest of the blood in the ventricle. And you can see the volume goes up again. Well, if there's something wrong, if you have a very stiff left ventricle, you might get another noise. And this noise is always pathological. That's an S4 heart sound. And we know that is an atrial gallop. And that's Tennessee. Always pathological. All right. So I'll tell you some of my questions I like. And then the cycle repeats. I like these questions. Where's the S4 heart sound in relation to the QRS complex? The S4 heart sound occurs right during the PR segment, or right during the PR segment. The heart is quiet, electrically quiet. So I can ask questions like that. When the heart is electrically silent, the S4 heart sound occurs. The S4 heart sound occurs between which phase? Between the PR segment, between the the PR interval, the PR segment, the ST segment, the QRS complex. Where does the S4 heart sound occurs? The PR interval right here. Right? Q wave is right here. All right, things like that. I like questions like that. All right, P wave dimensions. There's the 2 by 2 little box rule. We should probably stop this, right? This is getting kind of long. Let's actually stop it right there. That's a good place to stop. All right, have a great weekend. See you all for week 9 next week.